Right now across Maine, health leaders are paying very close attention to new HIV cases in Penobscot and now in Cumberland County.
According to the latest data from the Maine CDC, 31 people in Penobscot County have tested positive for HIV. Meanwhile, 5 new cases are now in Cumberland County. Public health leaders say the common denominator is injection drug use, and most people have unstable housing.
Here's News Center Maine's Sam Olson.
We've often called this a syndemic in terms of there were a number of contributing factors that really led to this outbreak.
An outbreak in Penobscot County that began with the first positive HIV diagnosis back in October of 2023. In response, the city launched a new program this October to offer medical case management.
That case management is really that hub, to continue connecting with people, make sure that they are getting the resources that they need.
Jennifer Gunderman is the director of Bangor's Public Health and Community Services. She says 17 people are currently enrolled in the case management program. Plus, 6 U.S. CDC staff members are currently working with local health partners in the area until the end of next week. Meanwhile, farther south, Portland public health leaders are assessing Cumberland County's 5 new HIV cases.
At this point, we are not considering this an outbreak or tied to the event in Bangor.
Portland Public Health Director Bridget Rauscher says they've been increasing awareness and testing in the city in response. She says some of these new diagnoses tell her some people might not be utilizing what's available.
And maybe aren't aware of the resources that they could be accessing. Maybe they have limited access to a syringe exchange. Maybe they don't know anything about pre-exposure prophylaxis.
Portland has its own needle exchange program, and there are 2 certified syringe services providers in Bangor. But as far as other communities, not everyone has an SSP.
I am nervous about the parts of the state that don't have easy access to an SSP.
In Sanford, for example, city councilors recently decided to halt needle exchange services in their community. Sam Olson, News Center, Maine.
Today, we reached out to Sanford City councilors and the organization that runs its harm reduction services. They were not available, but we are working to bring you more reporting about that story this week.